Well, when we were asked to come, well, first of all, thank you to the COI for inviting us here. It's our first time in Poland, and we're really excited to be here. And among such, like, I don't know, I was going to say intelligent and capable people doing all these changes in government. Well, we thought, well, what can we tell them?
Yeah? Did you apologize for the Polish language? We don't speak Polish.
Yeah.
Did you apologize? Sorry about that.
So we were thinking, what can we tell these people? What is the situation in Poland? What can we add? And we didn't really know very well, but we thought about this first time service design, because we thought that probably like happens with us, for many of you, if you start using service design, it will be the first time. We've been 11 years working in design, and 8 of which working intensively for government and with government, and the last 4 especially in service design. But when we are working in service design, it's always a first time. You never have a client that has a previous experience on that. And that's why
at least in Spain, even if it's a private company or if it's a public service, it's always the first time.
Yeah.
So it looks really similar to Poland.
We actually met some of the people who invited us here in London, and in London you can see that there are recurring clients and people who have like more knowledge of this. But in Spain it doesn't happen, and we assume that maybe in Poland it doesn't either. So we wanted to share some of our learnings with you, so when you start your first time, you have some ideas. Let's see. I'm a specialist on trying to point when it doesn't work. But, well, first, we will share this through 3 projects. We won't go in deep into the project because we don't have enough time, but we can tell you more about it if you're interested in the particular project. But we wanted to show you some examples where we took those learnings from. So there are 3 ongoing projects that we are working on right now. One of them has had like different steps, so we're going to talk about step 1, and you will see results. But the other ones are ongoing right now. So the first case is we've been working with a very small local council, the Sant Quirze del Vallès Council. That's a really small town near Barcelona. Like I think it has like 20,000 inhabitants, but it's
more or less
quite special because it's besides the university and besides many like digital industries, and all of the citizens are quite like digital and using many technologies and special. And that's why like 5 years ago, maybe 6 now, the city council started their own Facebook profile. I will put the translation so you can understand something while I speak. They started their Facebook profile and the Twitter profile, and immediately people responded. About 15% of the inhabitants already follow them in Facebook and Twitter, and they interact with citizens a lot. And naturally, they started receiving service demands and concerns of people, and the people in charge of media, well, they started doing the service somehow and responding to citizens. You have an example here of someone concerned with some cars on the sidewalk, and the city council, well, the people in charge of media, they responded the day after, and they sent the police, and the cars were removed, and it was much easier. So the citizen is really happy and really thankful for such a quick response, which never happens when you go to the physical office and make the questionnaire. And that was the beginning of it. Because at some point
it doesn't work. So we can see nothing there, but
that's fine.
We can use that. Yeah.
So basically what happened is like the city council at some point decided, well, why can't we do such an efficient service also face to face? And this involved, well, they put the person in charge of media in charge of this team of people that had been decades there working. And this is we wanted you also to have the same question that she had in mind.
Before going on, and explain you what we did there, we want you to
think how would you do something like that.
So we would like we will ask you to find a pair, the closest person to you, and we would like you to discuss how you will do that.
How would you start an innovative project in your organization? Something that really involves like a change and that comes to you, and
that's it.
And yeah, just find a pair and discuss for 2 minutes.
Come on.
You have the lights on, so no excuses. We're seeing if you talk.
Vale, no? Sí.
So time is over.
So
I see that people are starting to get more ideas on how to do this.
Actually, we really would like to know. We will love to know what you were talking about, but we have to keep on going. But at the lunch break, we would love to
hear some of your ideas. Okay. Sure.
But now here's how we did it.
So yeah, unlike Agnieszka, instead of trying to find something that was going to fail, our approach was to do something that you could immediately see a result.
And what's the easiest way? Demolish the city town building.
Well, it was easy because it was a project that they were already doing. They had budget for building the new office, so we used this budget also for starting the whole thing and understanding what was the service about, and this was done with the users and with the city professionals, the agents, and also then thinking about how the space contributes to the service, how the new space could be so the service could be easier, and also prototyping it with very, very low cost techniques. You can see cardboard new furniture here, and we had the people acting out the new services and the new ways of interacting with citizens, and we could easily see what worked, what didn't, and change all the furniture immediately. If you didn't like the, I don't know, high, you could just cut it out and you had a lower desk.
Something like a sign is needed, so you can draw it and try what happens if there's a sign, and a lot of things that are involved into the service.
We have tons of insights on the space, also on the timeline of the service. And we finally took out, apart from the new office that you will see now, a new job. This job here, of this woman here, wasn't an existing job, and nobody wanted to do it because it involved a new and much closer relationship with citizens. It involved stopping citizens when they came from the door and asking what they were coming to do, and diverting them if they didn't have, for example, all the paperwork needed. They could just go home and grab it or come back another day, but they didn't have to wait until half an hour until somebody told them and things like that. But nobody wanted to do it because they just didn't know how to. And here we have the desk of this person in front of the door, already built, and people do it rotatively, and everyone is really happy to do it because they played it out before and they know how to do it and they feel comfortable doing it. We also were working on the environment of where the desks where you receive citizens and where all the agents do their work, and this is how it ended. It now doesn't have any problem of, they were having many problems of privacy because there was nothing protecting one desk to the other, and they were also not comfortable for the agents to work. Now they are comfortable and they can move from outside, and they can deal with citizens without everyone hearing what they're doing. And also we developed a new attention model. You can see it here with a cardboard computer.
There were many things that came out from all this work, but they decided to adopt and evolve this new service that is a kind of hybrid service between the personal service and the online services, because we discovered that well, how many times does a citizen goes to the city? How many times does a citizen has to do a transaction with the government or with the city council?
Per year.
Per year.
Maybe once, twice. So what happens is that citizens don't use so much transactions online because they don't remember from one year to the other how to do it. So what we had here were two computers where you could do the self-service. But if you had any doubts, if you had any things that you didn't know how to solve, you could just simply grab the red tip facilitator and they would tell you how to do it. They will guide you through the process. And our conclusion from this project is that when you're starting, it's interesting to do some things in smaller steps and get quick wins. So you can prove the value of the new approach immediately. You don't have to wait like 2 years and do a big research and prove everything, which is great. But in the beginning, it's really impossible to do. Organizations need to know that this has any value and that this will translate into something practical that they can have implemented tomorrow. And this is why we think this is really, really important. Grab something that you can do and do it as quick and as immediately as you can. And this involves starting where you can with anything that is happening in the organization is a good start for service design. And also, when you have proven value, there will be coming new windows of opportunity. You have to be aware, and people will be more receptive because they've seen success before. Mm-hmm. And in this project, for example, we've been almost a year and a half already working. We've done many other small projects, and we are now going to start a new cross-council and council level team for change. So grabbing people from different sections, and they will build, and we will be sort of leading them into building a team for change, for changing not only the face of the council, but also the internal procedures and also many other things, and they will build their own innovations.
Again, we're going to keep going step by step and little by little, considering the thing of the small step and a quick win.
Yeah. Okay? So for a second case, we're talking about this Vinclas project. Probably you haven't heard about it, but it's quite known in Spain and quite criticized because it's about alleviating solitude of elderly people with mobile technology. Of course, there's many people who think that elderly people can't use mobiles, and many other people that think that technology can't solve all situations, and we have like this ongoing fight. It's so known because it's a whole new service that won Bloomberg's Majors Challenge last year, and it has a lot of funding, and it's a really big project, and it's always in the press. For you to imagine how big this is, we have a core executive team in the council, 4 teams of developers, like 4 big developing agencies and businesses working on that, 1 team of social workers, 1 team of social researchers, 1 team of policy evaluators, and us, 1 team of service designers. That, of course, were the last to come, because everything else was much more important and also much more conventional to think that, you will, if you're building something mobile, you will need developers, and if you're building new policy, you need policy evaluators. As you can see, like the big bulk of the budget and the project is into development, of course. And for you to understand, this is more or less the idea of the project when we came into it. So you have the main user, that is an old person, and around this old person there are maybe the families, friends, and all the professionals that they all have mobile technologies, and they are all connected, but they are not connected with the old person because he doesn't have mobile technologies and he doesn't access mobile technologies. So if you provide a tablet to this old person, he will be immediately connected back to his family, friends, and other professionals. This is basically like the underlying idea of the service. When we came, they had done a phase 0 with a pilot of 20 users, and they had built an app for these 20 users to use during the pilot, and they were doing a new app for the phase 1 that will have 200 users. And well, as you can see, they started with a technological solution as usual. They had already selected which tablet they were going to buy. They had already made a contract with Vodafone for the 4G connection for every old person that would get the service. They were devoting lots of resources to development. They had also done usability and user interface and done a lot of design around that, and they had been really concerned on accessibility for old people. So all this human side was also covered. But our question is, what is the service in all of this? And of course, we want you to find a pair and talk about this, but please this time find another pair and try to comment where is the service in all of this with another person. Would you do that? Yeah.
Come on.
Come on.
Different person or...
No. Okay, it was a trick question.
Yeah, we're a bit late, and Martin will kill us if we if we stay longer on that. But that was a question that we made ourselves. Where's the service in all of that? Of course, the obvious. There was something obvious, but for us as a service designer, what's the real service for that? Because go on.
So this is basically the process that we used for this particular project. In each project, you sort of redesign the process, all in at least we do for each project. And we're not going through that because you already know, you've been, so just for you to know, this is where we are. We're doing service blueprints and user journeys. This is a user journey. In the above part, you have the actions of the user, and then also the emotions in green. And in violet, we have all the touch points that, as the council, we are providing for this service to happen. And above all, were the questions and doubts that we had, even while mapping.
But for them, there was the first time that they were seeing something that has to do with a process for them. So it was like, wow.
It was the first time of seeing the whole picture of what we are doing here after 1 year of working on the project. But what we saw there was the underlying assumption that our service is the process of connecting the user with the technology. They were really concerned of how are we going to deliver the tablet to the user? How are we going to get the tablet back from the user if he's no longer able to use it? Or if he dies, and who's going to sign the contract? Because if this person dies and we need to get the tablet back, who is going to give it back to us? Is it their son? Is it? Yeah. So those were the kind of concerns that they were having. And well, we said, okay, we mapped that, but we need to do some research first. And we based the research on the relationships, on who's the user and how is he feeling lonely and why is he feeling lonely and how this translates into his day. And also this, we are baptized as the confidant, as the most trusted person that the user is related to. Here you have some basic insights. I'm not going through them because we're late in the schedule, of course. But we've discovered that many of the assumptions that were there were, well, challenged by the new insights that we have found. Because actually, like, old people do use mobile technology. They're already in contact with families, but they still feel lonely. So it's not only a matter of being connected, it's also a matter of something else. And since last week on, we've arrived to
actually it's about relations and loneliness. So.
We've arrived to this new concept, all of us and the council, that maybe besides the personal network, we need to build a social network where all these old people who are feeling lonely can connect with themselves. And this social network doesn't need to happen only on the tablet. It can happen also in the neighborhood, and they can physically meet face to face. And they also have this new figure of facilitator, someone who is going to be like making this new social network more agile and helping these old people to get in touch and getting to know each other. And gradually we have discovered, we have changed the point of view There are services connecting people both to strengthen old bonds with their families and their friends, but also to generate new ones with or without technology. And this is a whole change of perspective. It's really important. And also, we have realized that the APP is not the service. It's just a means to provide it. It can be really obvious for the rest of service designers here, but it wasn't so obvious when we came into the service. So our learning here is process versus value. So when you come to service design as a means of, oh yeah, we will see what is the process of this service, and then we will just check that, and we will write the procedures for our new service with just using the post-its, and that's it. But service design is more about value. It's not about just writing a new procedure. It's about, well, what is really valuable for the user, and when are we going to consider that this service is actually providing service and providing some value.
I'm glad. I think it has something to do with something you said before. I understood on the translation that is, the service doesn't have to shape the citizen. It's the citizen who has to shape the service. So it's really important to make this change of point of view. No? So that happened here.
Yeah, and well, just to let you know that forward with moving on with more prototypes, and of course we have to go back to research because we have no idea of how these new social networks.
Well, there are some pilots planned, and every pilot is going to be designed to get the information back to redefine what is needed in the service. So
and last, we will use like 30 seconds to explain.
We have 10 minutes.
Okay,
no? Marci?
Then we will use this to
10 more minutes.
Yeah, to talk you about a service that we are doing with the Barcelona Children's main hospital. It's not the only children's hospital, but it's the main one, and it's really known in Spain for being very both technological and very special in how they deal with children. And with these people, we've been working on finding opportunities for innovation in the patient's experience. So, well, as I told you, they have this idea of being a humanistic hospital. You can see here children being, well, I don't know what the word in English is for that, but you know.
Like that, but they pay a lot of attention to the user experience.
So how they are going not to feel like being ill and but being more normal and being more at home, or at least being distracted by having things that look more like a playful space and a different kind of relationship. But hospitals are still, even though they have this concept, are very complex. This is our stakeholders map in the hospital. And yeah, a lot of people may have this concept, but daily life in hospital is complicated. You have basically management, support teams, and frontline staff, if you take like the big picture. And well, none of them is particularly concerned with the user needs. Well, they are, but they cannot pay attention to that. Their main attention in their daily life can be internal conflicts, not having time to do things, or trying to map out a strategy but not really knowing what's happening on the, well, just beside the wall. Normally, as you have seen in the previous projects, we work with frontline staff. So while we are doing the process, we build a change, because people are working with us and they are making their own insights and their own realizations of how things should work. And of course, this leads to immediate change. Nobody has to accept that. It's just, they see it so obviously that they immediately change the way they do things. But in this case, it's been really strange, because we worked for a support team. We're working for the innovation team. So this innovation team, they are also disconnected from daily attention to patients. They don't know patients. They don't even know the other people in the hospital. It's really strange, because we go to interview someone and they introduce themselves too. For us, it's like a strange concept.
But we have to see that there's a difference between innovation as they think and then the scientific innovation. So they do research and they do scientific innovation and they work, in like a department, and then there's this other innovation department, no?
Yeah, well, they do, of course, they do medical innovation, but this is the same doctors that do, and this is like more digital and marketing-based innovation, and they're also starting an patient experience department for innovation. But well, the thing is that for us it's been really strange, and we've been doing ethnography by, well, observing and interviewing patients and also the staff from the hospital, and we've involved staff from the hospital also in doing ethnography with us and in analyzing all the data with us. This is one of the social workers in the hospital going through data with us. And with all this data, we built these massive user journeys that we couldn't even hang in walls because there were no single walls in the whole hospital where you can hang it completely.
This one was 6 meters long
per
2 high, so
it was really big. But when you're trying to map out the experience of, well, this is the experience of diabetic patients, and maybe they start with diabetes when they are 3 and they leave this hospital when they are 18. That's a lot of time. So it was really like strange, and we also shared all our insights and all the data that we had collected with the hospital staff that were in charge of this services, and they were adding all their insights too and contributing to our research. For them, again, it was the first time they saw the whole picture of the service, which is strange because it's an existing service, but because it's done in bits and each different department does a little bit of the service, they had never seen it completely as a whole timeline. And of course, when you don't do the whole service as a whole timeline, but you do it in bits, there are many discontinuities and many inefficiencies and many things that fall in the pits between the changes of this department. And we also discovered what were the main pain points for users and many insights around how users see and concept health and care, and what do they expect about the hospital care and what do they need from them. And any of those, just any tiny little post-it there could be a project of its own. And that's what we normally do, just select one post-it and go on, because we're normally more concentrated on one discrete project. But in this case, we had to choose between, well, everything, because we were not just working with one department, but with the whole hospital. So when you're doing something like that, how do you start?
Only 1 minute.
Yeah, only 1 minute this time. Try to find a third pair if you can, or if not, just stay with the same one.
How do you do it? It's
I mean, maybe you have experience on that. We would love for you to tell us how you do it. Yeah, you seem a little overwhelmed by possibilities, and what we did, instead of selecting just one of the cases that had appeared there, was trying to map out what were the big opportunities for the whole hospital. And this we did with the hospital staff. They went through their own services, collecting what was working well, what wasn't working well, what could be improved, things that occurred to them, new things that weren't there at all.
Well,
and
in that phase, there was people involved, like first nurses, doctors, also people from the direction staff of the hospital, no?
The management,
and
also administrative staff, all kind of people. And well, they mapped out their own ideas, and also because management was involved, it was a collateral damage also, that they saw the interesting opportunities of having this kind of techniques used. They were really interested because for the first time they could also see what is happening in the hospital and spot many things that they didn't know that were happening beside their own law. And well, we in total, after analyzing all the results, we managed to see that there were 6 main areas of opportunity for the hospital to innovate the services. And they were common to all the hospital. In the basis, they need to attract more patients and make bonds with existing patients. Related to health and also safety, and also a little bit with emotions, but mainly health and safety. They needed to build a better cross-departmental and personal assistance, so you can guide the patients through all these changes and they don't feel these discontinuities so much. There were also opportunities for communicating with doctors and sanitary staff from home, and training when they were back home after a big illness and maybe a chronic issue that you need to take care of when you're home. You need to be trained for that. For example, if you're a diabetic patient, you need to be trained how to cure yourself, well, how to treat yourself. And
well, in that case, treat your sons.
Or your sons. And also there was like the biggest, like the highest thing that you could do is improve the emotional support to patients. So about managing fear and managing all the expectations of what you are going to get in the hospital, and also the idea of feeling normal and improving how you felt that you're at home and you're normal even when you have to spend 1 year in hospital. We've been also translating them into digital services, so this is ideas for new digital services in these 6 areas of opportunity, and right now we are starting to prototype them. But what we wanted to tell you is the idea between discrete projects and a strategic view. So sometimes you start service design to do a particular project and you do research around this project in concrete. But sometimes when you do a big research around the whole organization, you're going to get thousands of projects, but especially what you're going to get is a big strategic view of what are the opportunities for you to innovate, not now, but in the longer term. And it is also interesting because we started talking with quick wins and doing something immediately, but also having a big strategic view is interesting, even though you are doing a smaller project. But you need to like not be lost in the wood of the smaller projects, but trying to have like a longer view. So starting with a big research opens a much wider field for innovation, and it also gets the weight out of the easiest and the most urgent things and puts it more on selecting what is really important and what can be different from what other people are doing, because many organizations tend to just copy what is happening in other similar organizations without critically knowing if this is what you need. So it's interesting when you do this big research. And just to end,
collateral damages
of doing service design is that you get, well, this actually
all these people are managers of public organizations
in Catalonia. Maybe ports and
there's something from
economical development,
police also.
But yeah, they started with ties, but they ended like that. So you have teams that are more empowered to change their own work, and they are also happier because they can contribute and they can see the difference between how they were working before and how they can, well, just change the things that they know they don't work in their own jobs. And just that our final thought is that all of this doesn't start with the service design agency. It starts with the inner activist. It starts with someone who is inside and is motivated for change, has the ability to gather some resources and has some projects in mind and has a sense of urgency. So has something that wants to start doing right now. And this is one of our favorite activists, Gemma, and she's been doing projects with us and also going to conferences with us. And finally, this that she has here, because she's working face to face with people, she can't have all the big sticky notes and fashionable stuff. But she has this is well, how do you call that? It's not a cupboard, it's not a wardrobe, it's something where you, well, something with a door where you where you put your things when you're in your office.
They can see it.
She has her blueprint there, and every time she starts a new transaction that they have to do with users, she starts doing all these sticky notes with the service that they are doing new, and she does this with her team. And even though it's hidden, they have adopted all the methodologies. So our question for you is, are you an activist too? Are you ready to start service designing?
Thank you.
Thank you.
Thank you very much.